Are you in favor of euthanasia? Euthanasia is the practice of intentionally ending a life in order to relieve pain and suffering. There are different euthanasia laws in each country. In the Netherlands, euthanasia is understood as termination of life by a doctor at the request of a patient. Euthanasia is categorized in different ways, which include voluntary, non-voluntary, or involuntary. Voluntary euthanasia is legal in some countries. Non-voluntary euthanasia, patient's consent unavailable, is illegal in all countries. Involuntary euthanasia, without asking consent or against the patient's will, is also illegal in all countries and is usually considered murder. In some countries there is a public controversy about the moral, ethical, and legal issues of euthanasia. Those who are against euthanasia may argue for the sanctity of life, while proponents of euthanasia rights emphasize alleviating suffering, and preserving body integrity, self-determination, and personal autonomy. Proponents of euthanasia have presented their arguments. People have a right to self-determination, and should be allowed to choose their own fate. Assisting a person to die might be a better choice than requiring that they continue to suffer. It frees up hospital beds and resources. Pro-euthanasia activists also point to countries like the Netherlands and Belgium, and states like Oregon, where euthanasia has been legalized. There are some major arguments presented by opponents of euthanasia. Not all deaths are painful. Alternatives, such as cessation of active treatment, combined with the use of effective pain relief, are available. Legalizing euthanasia will place society on a slippery slope, which will lead to unacceptable consequences. It is not moral to end the patient's life because he has the right to live longer. In fact, in Oregon, in 2013, pain wasn't one of the top 5 reasons people sought euthanasia. Top reasons were a loss of dignity, and a fear of burdening others. In the United States in 2013, 47% nationwide supported euthanasia,